This is Trey K, and you're listening to Us and Them from PRX and West Virginia Public Broadcasting. Many states are predicting that the peak of the COVID-19 cases will happen this summer. Health officials in West Virginia believe their state has passed that first phase of the peak a couple weeks ago, a kind of a suppression phase. Now they say the state is entering a more complex phase, which is a kind of a living with the virus phase. And it'll require more testing, and they predict that there'll be more cases and maybe more deaths. But this pandemic exacts more than just a human toll. It's managed to fracture many of our healthcare institutions. When the state of West Virginia was in quarantine mode, hospitals delayed and canceled many medical procedures. People shied away from elective surgeries that are just the kind of procedures that make money for hospitals. As a result, revenues are down. And some healthcare systems have laid off staff just to keep costs down. Recently, West Virginia Governor Jim Justice lifted those restrictions to allow elective medical procedures. A few weeks ago, West Virginia University's men's basketball coach, Bob Huggins, was part of an ad campaign.
To protect everyone's health, we've been washing our hands frequently, social distancing, and staying home. But the game isn't over, so don't stop now. And if you chose to delay a critical procedure or surgery until after the pandemic, it's finally time to get back in the game.
Huggins encourages people to contact their doctor now to reschedule that appointment. As medical systems come back online, I've been thinking a lot about how this pandemic has affected hospitals across the country, but particularly the hospitals in West Virginia. I recently spoke with Dr. Clay Marsh of West Virginia University's Department of Health Sciences. Dr. Marsh was picked by Governor Justice to be the state's COVID-19 czar. And he believes that this pandemic is an opportunity to fix part of the state's healthcare system that fails some West Virginians. How financially stable are West Virginia's hospitals and clinics in this COVID-19 era?
Well, I think that it's interesting that as you look at these kind of stressors, and COVID-19 is a massive stressor, some people would call it a black swan event, which is a very rare, massive event that creates so much stress on all systems that it makes things change. And so I believe that as you look at small hospitals in general, small hospitals are much more fragile and much more susceptible to changes in the environment, whether it is in the reimbursement environment or whether it's in the patient flow environment. And much like you see in the past where, when I was a kid, there was I don't even know, probably 25 or 30 airlines, and now there's like 4.
Right.
But you see this great consolidation because the infrastructure that is needed to be supported gets to be very, very top heavy. And so for a lot of hospitals, because of the need to get the latest MRI and the heart hospital and this and that ultimately size and scope and buying power, like Walmart, is more successful than smaller mom and pop stores. And I think you're seeing that transition in healthcare. These kind of events amplify that. It makes the fragile break faster because we ask most of our hospitals to reduce their capacity because we're worried about a surge, like in New York City or Italy. And that's really one of the dangers of the COVID epidemic or pandemic. People spread so fast that it overwhelms the health systems and the number of ventilators and ICU beds.
Right.
And so we asked people to back off so that we had capacity, but that kills their business model. So that further amplifies the financial stresses of every hospital, and that's particularly magnified at very small hospitals.
But that was happening before this. I mean, we were seeing a big institution like West Virginia University or the Charleston Area Medical Center that in many ways they are branching out into more rural areas and offering care that maybe in some ways is better and superior to what was already there in a regional hospital or a community clinic or something like that. But you earlier in this conversation used the term Walmart. When Walmart comes in and the mom and pop store gets crowded out, what happens to the people who are in that rural area when Walmart decides, you know what, the business model's not so great for us to be here?
Well,
And they go away and mom and pop's not there anymore.
Yeah, I guess what you hope is that the Walmart type groups and at my day job at West Virginia University and WVU Medicine, we're part of Walmart. And so the hope is that we start to employ some of the people that may not have their place stay. And then we put, assets or help use the assets that are being abandoned to try to provide local health care. The goal is never to go disrupt and take over and crowd out local healthcare assets. The truth is, though, as you said, this has been going on for a while, and this COVID thing has accelerated the decline. It's fractured the fragile. And so I think that what we see is those are probably not sustainable no matter what, but during this time, it's happening faster.
It's really kind of putting organizations that are already kind of weak through a stress test. COVID is the stress test. Where will rural regional hospitals and clinics in West Virginia be after COVID? Where do you think?
We have 3 big health systems and really 4 big health systems in the state. We have Mountain Health, which is Marshall University.
Right.
We have Charleston Area Medical Center. And then the 3 I was thinking of is really we have Mon Health and WVU Medicine in the north. It's kind of a shared thing. But I think that at some level, most smaller communities will probably have some connection to these 3 health systems. But it also could be that there may be consolidation at some point with some of those groups too, because of the reimbursement and the fact that insurance is reducing their payment. And there's so much money in healthcare. We're now almost 20% of GDP, because we know that sick care, critical care, heart care, cancer care, neurologic care, what you see everybody investing in, including WVU, is the stuff that reimburses the best. It's the most complex care, and it's really designed to rescue people from failure. I think what you'll see over some time is the population health, which is really designed to help people be healthy and stay in their homes. Let's try to help people live a better life. Let's help people be healthier, and that will kill the business model that we have right now.
I was speaking to a public health doctor not long ago, and one of the things he said to me was, after this COVID pandemic passes, I really hope that the healthcare system, the national healthcare system that we have in America, is not the same as what we had in January 2020 when we first started hearing about this pandemic. Do you think that's a possibility?
Oh, I think it's probably more than a possibility. I think our health system, and probably in many ways our university systems, our governmental systems, the NIH, you think about it, our industries, our businesses, our banks have really been generated top down, where we looked for business efficiencies. Part of the COVID pandemic is we got so reliant on other countries' supply chains that we wanted just in time, like from China, for all of our personal protective equipment. We got caught with our pants down because they basically failed and they used their own stuff. And we didn't have anything. We didn't make it anymore. We relied on other people to give it to us. So I think as we go forward, healthcare will change because of the stress. So to save money and improve outcome, let's help people be healthier. I think that's going to be the natural direction that things will go over time.
I guess as you say that, though, that just seems like a huge political battle. It seems to me that our tendency is to not pay for something up front.
Maybe it requires a dynamic stress event that we've never seen in our lifetime that some people might call a black swan event. In history, these events are the things that change things. It gives us this pause to be able to say, what would we want in our lives and what we want to leave from our lives? And I think that for the people that are motivated that way, this is an incredible time of opportunity. But at the same time, that is so painful to see people that are in this mode of, not feeling safe anywhere. But ultimately, I think that that's what transformational change is. And we had it during the 18 pandemic and the Great Depression and 9/11 and other events. But this one may be more foundationally catastrophic to many things that we know because of the impact on our economic sectors and on our ability to have confidence to do the things we did. Maybe this is an opportunity for us to heal ourselves a little bit too, and maybe just to take a breath and not to be so anxious just to immediately get back to our old way of life, but maybe imagine something that may be even more extraordinary at a personal level that can give you a stronger sense of calm and a sense of the bigness that this is. This is all way bigger than we are. And I think that sometimes it scares us, but sometimes it inspires us to think differently.
Well, I have really enjoyed this conversation, and I want to thank you so much for taking the time to speak with me, and I wish you well on all that you have to oversee. It seems like a mammoth task. It just seems like every moment is like at least a week. So many things happen, and it just unfolds in some ways so quickly, and in some ways it feels so slow.
Absolutely. And these moments are moments of change. And I think it is really our opportunity to make this change one that's really a positive one long term for everybody and everything. Because until we have the vaccine, until we have the solution, then the virus is going to be with us. And I think that this is just another adaptation that we will need to make together, even though that seems very daunting at the moment.
Music lifts us up and brings us together, even when we can't get together in person. Mountain Stage brings you live performances on the air, online, and in our podcast. They remind you how it feels to be in a live audience listening to live music. This is Larry Gross, host of Mountain Stage. Find a link to our stations and our podcast online at mountainstage.org.
You've been listening to Us and Them. Our team for this show was me, Trey K, Xander Alloy, and Kate Smith. Michael Lipton and Tristan Lozow wrote and performed the Us and Them show music. Mark Lerner designed our logo. Lelena Price provides us with images for the web. The marvelous people at PRX and West Virginia Public Broadcasting make Us and Them possible. So do grants from the Corporation for Public Broadcasting, the West Virginia Humanities Council, and the CRC Foundation. This episode is supported with a grant from the Claude Worthington Benedum Foundation. Us and Them was originally developed with assistance from the mentorship program at AIR, the Association of Independents in Radio. We'll see you next time on Us and Them.
Support for this podcast comes from the Corporation for Public Broadcasting.
From PRX.